Hi, my name is Cinti Gutierrez, and today we're going to talk about the evolution of the breast screen program of New South Wales, which is a program coordinated by the Cancer Institute that is part of a wider national program to detect breast cancer in early stages, before it spreads and becomes more difficult to treat. It is founded by the Commonwealth State and Territory Government, and it aimed to reduce illness and death from breast cancer by detecting the disease early, because early detection of cancer increases treatment options and improves chance of survival. Women over 40 can have a free mammogram every 2 years, and is especially important for women between 50 and 74 to screen because most of the breast cancer occurs in this range of age. Breast Cancer Australia program is for women without symptoms. If you find something unusual, you should go to your GP or healthcare worker for further assessment. Cancer is a non-communicable disease or chronic disease that occurs when cells grow out of control and crowd out normal cells. It can start in any part of the body and is potentially fatal because it can disrupt proper organ function. Cancer is a public health problem because it's the second cause of death around the world, and breast cancer is the most common type of cancer in women, with 27% of total cancer cases, according to the last report from the Cancer Institute in New South Wales in 2010. The risk of having breast cancer in women at the age of 85 is 1 in 8 and 1 in 3 for any type of cancer. In 2003-2007, Aboriginal females were 20 less diagnosed and 45% more likely to die of breast cancer. It is important objective to at least equal Aboriginal and non-Aboriginal diagnosis of breast cancer to prevent death from happening. With this known, a primary health system evaluation could be if the breast screening intervention is effective in improving breast cancer detection. And secondary, what factors do Aboriginal females in New South Wales identify as barriers to accessing breast screening? And what could help increase the access to the breast screen program? A quick answer to the first question is that in fact has proven to be effective. The program started in 1991, targeting women from 50 to 69-year-old. At that time, the 5-year rate of survival to breast cancer was 77%, which improved to 92% in 2014. Nevertheless, Aboriginal females still have lower participation rates. For the boundaries and dimensions of this assessment, the geography will be the state of New South Wales, age between 50 to 74 years, gender females, population Aboriginal, and time lapse between 2018 to 2019. According to the Bureau of Statistics, there were 90,000 Aboriginal females in New South Wales between these 2 years, which is the time lapse that is reported in the Cancer Institute program. For the comparison groups, it's important to ask participants what should be improved and ask not participants what they think is required to increase participation. The sample size of each population type must be representative, and it should be collected randomly to reflect general thoughts. The sample size equation for lab population is the next one, and we calculate a sample size of 270. Set a score chosen for the confidence interval of 95% and a standard error of plus minus 5%. The deviation standard P, when unknown, is equal to 0.5. The measuring techniques for Aboriginal participants will be surveys in electronic devices to facilitate recollection and data analysis. That can be applied in the same appointment. And for non-participants will be telephone calls. It is important to have at least 270 people surveyed for each comparison group to ensure that the results obtained are accurate and represent the population thoughts. The plan to conduct the evaluation will require to prepare the questions, select random locations, instruct partners to conduct the surveys, mobilize resources such as financial, technical, and human resources, to ask the participants and collect and analyze the data. It is important to insist that the evaluation should benefit from the program as it is, to reflect strengths and weakness, reduce cost, and integrate the elements required to improve the program. To report the outcomes, a thing we notice is that the results from previous years are not available as raw data, and we had to take the numbers from the images, which is harder than just download a dataset. Hence, statistical not personal data should be available for everyone. It is also important to present results in different ways, such as different indicators and graphics, because this will help to show particularities. For example, participation rate by population type, but also as a total. Report to people through media can be done with a video, and the results are to be delivered in format report and database to the Breast Screen New South Wales, Cancer Institute of New South Wales Ministry of Health, and the Aboriginal Health and Medical Research Council. In conclusion, the female age between 50 and 74 Aboriginal percentage of the total population in New South Wales is still small, around 1.75% of the total population, but will continue growing and will require the same screening as any. Evaluation of the program is required to be focused on the population type of cultural and linguistically diverse women. As we can see in the graphic, we have a 23.75% of the total population of this range, of the female range, and it is important to increase the participation rate that is presented in the table. Thank you very much, and remember that a minute of compression may save your life. I will leave you with a 2-minute video from the program.